Dear students, welcome and thank you for tuning in to this video. We are going to continue our discussion about the measurement of the respiratory system. I wanted to continue and add some information about ventilators and respirators in the sense that we would like to understand and review the method to stop inspiration in ventilators. So an inspiration process is controlled by ventilators, and the inflation of the lungs continue until one of the following conditions is satisfied. The first condition is that we keep delivering the gas until the gas reaches a predetermined pressure in the proximal or upper airway, and this process is called pressure controlled or pressure cycled ventilation. The second condition is that we reach a predetermined volume of gas that it has been delivered to the patient. We call this volume controlled, or we call it volume cycled ventilation. The third condition that we want to satisfy is that the air or oxygen has been applied for a predetermined period of time. A ventilator that operates in this mode called time-cycled ventilator, and it's a pressure controlled. This is a quick review about how we are controlling the ventilators or the respirators. We have something called intermittent positive pressure breathing apparatus, and this is the apparatus that is actually used for abbreviation. It's IPPB therapy. It has special procedures and equipment. It is type of assisted breathing patterns in which the lungs are inflated by positive pressure during inspiration, and on the release of the pressure, expiration occurs passively. The IPP is for patients with one of the following problems, for example, chest disorders, bronchitis, edema, nervous system disorders, and many other conditions. So this is a very important piece of equipment or apparatus to be used. Intermittent positive pressure breathing apparatus. The objective of the IPPB are to assess and promote multiple functions. Some of them are more uniform ventilation. We need to facilitate better O2 and CO2 exchange, oxygen, carbon dioxide. Also, aspiration of antibiotic drugs could be done using the IPPB. And also we want to relieve bronchospasm. And the bronchospasm is a condition in which the smooth muscles that are surrounding the veins and the arteries in the lungs are actually contracted, and it makes veins and vessels smaller in size, and they are not narrower, and they're not providing the adequate amount of blood. So there's a lot of different conditions. Also, it's used for exercise the respiratory muscles. And usually in the IPPB, medical gases are commonly used, such as oxygen. We have compressed air, and also we have oxygen helium mixtures. And we're going to touch base on all of these gases and when do we use them and why do we use them. Another important respiratory assistive procedure is actually the cardiopulmonary resuscitation. So under emergency conditions, when we don't have access to an IPPB respiration apparatus, we use cardiopulmonary resuscitation, which is the CPR. And this is a technique used to maintain the blood flow and oxygenation when we have a heart attack, which is the fibrillation, or respiratory arrest is present for the patient. In simple terms, it is actually pumping rhythmically on the patient's chest with the palm of one hand while periodically blowing air into the patient's mouth. If we need a long-term respiratory treatment, we need to use a therapy device, an IPPB device. Thank you for watching, and in the following videos I will keep discussing more of the different types of the assistive devices we use for ventilation and respiration. Thank you, until the next video. Bye.